Forgive me if I'm wrong, but I don't think you have a labor and delivery background, right?
I started my nursing career in trauma at a level one trauma center in Atlanta, one of the big ones called Grady. And I floated around to neuro ICU, medical ICU. I can save any life any type of way. And then I went into education, or I'm actually just finished the coursework for my master's in nursing informatics. So when I tell you far away from maternal care is possible, I just was very ignorant to the specialty outside of nursing school, which we know as nurses, once you pass that class, it kind of goes out of your mind unless you're going into that specialty. So when I went through this pregnancy journey, I almost became an expert. That's how much research and advocacy I had to do because my journey is just so dynamic, unfortunately. So I had to do a lot of certifications to just to be more well versed in this community, and it served me well. And the community is so receptive of my business.
Yeah. So congrats on your finishing up your master's in nursing informatics. That is huge. I have my master's too. I know what of a brain drain that
Yes.
is. So
Yes.
congrats. Let's take a second for that. And also I love when nurses are building on this super exciting business venture without having like a bedside clinical experience with it. Like you haven't worked for years with that, or that they don't have like a master's in that certain niche, because I think it really shows nurses listening that you can take a passion and a personal experience and you can kind of blend that with your nursing ability to research, knowing like client advocacy and all of those different aspects. So that's just why I ask. I always love when nurses aren't limited by like their clinical experiences and they just think outside of the box and they just know how capable they are. So it's like beautiful that you were able to like see that career path without pigeonholing yourself.
Yeah, absolutely.
Yeah, yeah, I love that. That's
So I,
one of my
uh,
favorite things. Um,
I think just going into it from a different perspective can lead to a lot of innovation, right? Because it's different from being, the patient. And then I have that perspective from nurse and patient. So from a patient perspective, I know about patient advocacy. Unfortunately, I had to report a lot of mistreatment and false documentation and just a lot that could have cost me my life and definitely cost my baby's lives. So I think when I'm going to, because I have that experience, I'm able to go into it with all of these thoughts and ideas of how we can reinvent that wheel that needs to be reinvented.
I agree. There is some like crossover with medical writing too, where people are really excited that I have that nurse background because I see things just like in a different way. It's kind of like your superpower, like ability to do that. So I always like remind people that you're not leaving your clinical background, you're not leaving becoming a nurse. You're just like taking all of your nurse knowledge and you're just putting a new fun spin on it to support like a different
Yeah.
population that you didn't support at the bedside.